The Deputy Premier and Minister of Finance, Honorable Floyd Hall, and the Minister of Health, Honorable Lilian Boyce, are in London meeting with officials regarding funding for the arriving state-of-the-art hospitals. Our Deandrea Hamilton will be with both members of Parliament and, of course, is bringing us day-to-day coverage. Let's take a look.
Thanks, Angie. We're here at Senator House in London City, in, of course, London, England, where the Turks and Caicos is anticipating a revolutionary decision. It's been years and years in the making, according to my understanding. And we're talking about the two hospitals which are to come for the country, one set up in Providenciales, the other in Grand Turk. Here is our senior policy advisor to the Ministry of Health, the Honorable Royal Robinson, who has given us a briefing, the media that is, this morning, or rather this afternoon, on what is happening with the hospitals. And he's told us that a number of great events have taken place, including they have actually managed to identify a financier for the hospital, a company called InterHealth Canada, who has not only devised a financial plan, but they've also devised a plan that will actually cause construction to happen effectively, as well as staffing to happen effectively. And so it is looking like a really solid plan, according to the government, for the coming of these two new hospitals. The entire project will unfold, we're told, over 24 months. The construction will begin in February 2008, early February 2008. One facility will be 1,700, or rather 17,000 square feet. The other will be 15,000 square feet. There will be two-story buildings and of a Caribbean style. Now, this is a really big deal, according to the Ministry of Finance in particular, because what it does is it causes 83% of the cases that we ship abroad, medical cases, to be dealt with at home. For those that have been following this situation with the two hospitals to come, you would know that originally there was a study done by the UK some years ago that cited Providenciales as the ideal location for just one hospital. Under a different government administration, it was suggested that there be a hospital in Grand Turk. And then a subsequent government administration for the Turks and Caicos suggested, you know what, let's have it in both Grand Turk and Providenciales. This has forced the current government administration to seek out a group that could actually negotiate this process for them, and they've decided upon Eversheds. They've been brought on from the United Kingdom, of course, where we are today, and have been managing the entire venture along with close consultation with a number of people from within the government, including Mr. Delton Jones, who's headed the finance, and he is our permanent secretary in the Ministry of Finance. Rhonda Lee Brathwaite Knowles, she's been on board as a Turks and Caicos legal counsel. Dr. Rufus Ewing has been on board as well in the area of clinical oversight. And, of course, Denise Saunders has been on board as human resources, along with Lorraine Bovell, who has been for information management and technology, and as mentioned before, Royal Robinson, the Honorable Royal Robinson, for infrastructure and design. And so it looks like it's just a matter of hours now, Turks and Caicos, before this agreement is officially signed. Tomorrow, that'll happen at DLP. Also here in the UK, these are the legal advisors for the Canada group. And again, that construction is set to begin in early February, takes 24 months to be done, and we will then be outfitted with two new medical facilities, two new hospitals for the Turks and Caicos. I'm being told that it is the biggest capital investment ever in the Turks and Caicos, both in the past and for the foreseeable future, at over $100 million. For WIV4 News from London, England, Deandrea Hamilton.